on you, Collins Odote.
Thanks, Dibal. I'd like to speak about the two issues. I'd like to speak about social measures, and then I'd like to speak about the economic one. But let me start with the economic one. Over the weekend, I think on Monday, or in one of the newspapers, somebody from the hotel industry in Mombasa was making the point that, you know, from around May, hotels are normally closed for purposes of, it's the low season, so that's the time they do repairs, and his concern was that, you know, we might not even be able to do repairs this year, for, not because of lack of money, but because the goods that they use for repairing the hotels come from China, and that there's a possibility they may not be coming this time. I don't think that we're thinking about that at all. While we're appreciating government for the response they've had over the last 1 week, I think the response has largely been health response, how health prepared are we, which is a useful thing. But I think we need to realize that this disease has many more implications. It has an economic implication. Our economic preparedness is important. It has a social implication. Our social preparedness is important. I don't think we are economically prepared. I don't think we are socially prepared. On Sunday, CNN carried a story about Milan. Milan is one of the cities that are extremely affected. And you could see that a lot of people were not on the streets. But what was hilarious, there was these people, I think from Montenegro, who were on the streets kissing. And their response was, you know, this disease does not exist. This is a myth. Life must go on. I think there are quite a number of us who are still behaving as if this is a myth. And we need to start realizing this is not a myth. We need to start being real. I kept asking myself, why are the countries that are shutting down schools saying they're doing so for 2 weeks? What's the magic about 2 weeks? But if you reflect, I think they're saying we need a window for us to be prepared and know that this is how much we know before things happen. When I and myself teach at the university, last week there was a conversation at the university in terms of asking the university itself, how prepared are we? I don't know what answer we have. I have kids that go to school. I don't know whether the schools that my kids go to know how prepared. But that's Nairobi. We haven't gone to the rural areas. How many parts of this country do not even know that coronavirus exists? Yet when we think about travel, we think about travel only here. Dibal, it's only today that you hear government is saying we will be able to find information about where somebody has traveled from and where they have gone to. If I traveled from Italy yesterday and I have gone to my rural village in Husero, who knows that I'm in Husero? Do the people of Husero know that coronavirus exists? If I refuse to greet them, will they agree? You know, those kind of basic conversations. I think there are certain things that we must do publicly to be able to pass the information. That's why when the conversation about reducing the rallies, it's not a political statement. No, it's about how do the politicians make statements that enable people realize the implication. Dibal, the Speaker of the National Assembly, did an excellent job in terms of saying we have cancelled the trip to the US for members of parliament. But what's the conversation about the trip? The conversation about the trip is not about the fact that it's a preventive measure. The conversation about the trip is, so what is the financial implication of the cancellation of the members who already had per diem? Let's make this slightly more serious. Let's start discussing the kind of, because prevention, as we were told in very early days in primary, is better than cure. There are basic things we can do, Dibal, that will ensure we are more prepared and that we deal with the consequences, just as opposed to only focusing on where is the money for masks, where is the health facilities. Why are people saying we are not saying hello to each other using hands? Why are people saying that we need sanitizers? In public facilities, for example, now all public facilities have sanitizers. Are they there in schools? Are they there in schools of higher learning? Are they there in public offices? You know, basic things. If you work in government, Dibal, you are exposed because the amount of visitors that you must treat them. Are they being told, don't greet? Is that something that's being put in public? So when you don't greet people, they also don't think that you're being rude. Let's do some much more than just what we are doing currently. And I think there's a lot we need to do. On the economic front, you know, this virus is telling us, number one, that we are extremely reliant on China. Extremely. And people, the times people, I think it's last week when somebody made the important point that, you know, we need to start, it was the governor of Laikipia.
Yes.
We need to start asking ourselves, what is how much are we supporting the domestic industry to produce things? And I think the lesson this must also bring for ourselves, the more you don't support the domestic industry, it's not just an economic issue. It is a livelihood issue, because if you are relying on things like even matchboxes, if you're relying on toothpicks from those kind of, then it means that if there's a lockdown, you will lack even basic facilities. And I think our support to the small, micro and small enterprise industries, the kind of conversation government had last year, we must now take them much more seriously as a matter of also ensuring that we proof our economy from kind of responses in the long term.
And that is a fantastic point he's making. I think there is an opportunity because of coronavirus, a huge opportunity. It's the upside of it. And I think he has hit it. And I think it's time we start thinking about being diversified in terms of our imports. We need to start thinking. We need to start thinking about how do we make trade within ourselves, the Africa Free Trade, work. Because we have reliance on one source. And I think as we look at this, I think we need also to spend, what are the opportunities? What are we learning from it? If you go to Zambia, you go to Malawi, you go to Nigeria, we are dependent on this nation. How can we find an opportunity to start relying on ourselves and indeed putting so much effort in terms of our own entrepreneurs? And I think the conference which has just ended, KICC, I think these are the things we could talk about. How do we make our own people to be now? Instead of relying on China, I can get it from Uganda if it's cheaper. So there is also an opportunity we have to learn about it.
Robert, did we now focus truly on, looking at the East, facing East, as opposed to the West? I think that was also the mantra that we're using, facing East right now. And this is maybe the blowback of it, where we are heavily reliant on the East. Now, of course, things are coming home to roost.
Well, remember, whether it's East or West, coronavirus is global. And that's, I think, the thing, if you look, for example, at the number of cases in Italy, and then you look at how dependent we are in the north coast of Kenya for Italian tourists, you'll see the hit. So I think that's just one aspect. But I think overall we must look at it. Nairobi in Kenya is not just a country in East Africa, it is a regional hub. This place, even if we've stopped flights directly from here to China and vice versa, there are many people coming in via Addis, etc., etc. So, because we are a regional hub, many activities are based here. It's very difficult to actually be working in this region without going through Nairobi. So we've got to, that's why I think we are regarded as being very vulnerable. We are. I mean, I personally would not be wanting to walk around Jomo Kenyatta Airport or even Moi International Airport at the moment. I just wouldn't, because you don't know where different people have come from. You don't know their backgrounds. You can't stop people and say, have you come from where? You can't do that. But you know that interaction is there, and that your risk factor is there. So I think that's, we've got to be aware that we are vulnerable, we've got to, and I think we're starting to get there, but it's taken a while. We've got to, as a government and as a country, realise that this should be on the front page. With due respect to BBI or the DP or whatever, or Ryler, etc. This is the country. Let's be prepared. Let's educate each other about it. I've seen some very good summaries of this. It's not rocket science. I mean, this is fairly elementary stuff, and there's quite good preventive measures, and there are also in terms of actual treatment. There is quite a lot. Unfortunately, quite a lot of that is in China. So we're not going to be able to source that very easily. But, I think we just generally need to be much more prepared and aware. When you walk out and talk to people, they don't really see it as a serious thing, you know. And I think that comes partly from government, because government didn't take it seriously at first. And so this public education awareness, I think, is absolutely vital. Because yes, it's not just the economy. You know, our schools could shut down. Can you imagine if all our schools shut down? You know, just that alone, that has a huge impact. So I think we you know, and preparedness in other ways as well. One isolation centre, hold on. What if it really did take place? Let's be prepared and have several in different areas, just in case, you know, just in case. We don't want to be accused later, or the government certainly shouldn't want it to be accused later, of doing too little too late. And at this stage, we don't know how big or how little that the impact of that is going to be on this country. But let's be cautious and say it's going to hit us health-wise, and therefore let's be a little bit more prepared than we are at the moment.
Right.
Yes, I want to make three very quick points on this conversation of coronavirus. You know, we've had a conversation in this show about the Big Four agenda. And I think I shared my views and my opinions about, you know, the likelihood of Kenya being a serious manufacturing country. And I said to you, I don't think that's in the horizon. I mean, if countries like South Africa that have much more, you know, stronger manufacturing bases than ourselves are actually, you know, rolling back because of the global liberal trading regime. I also shared my view on housing, saying that, you know, that should really be left to the private sector. And there's no emergency in trying to say, let's achieve this within now and 2022. And I think the numbers speak for themselves. But, you know, to the topic of universal health care and the topic of food security, I think there's a huge opportunity for us as a country to transform ourselves on those two pillars. And on primary health care, I mean, I think, and I've said this before, you know, the primary health care is actually, there is empirical evidence that primary health care has a very direct impact and consequence on the health of a population. I think what we did as a country is, again, we went for universal health care and went straight into procurement of the most expensive equipment and spread it around the country. So billions and billions of shillings have been expended on equipment. But actually, the reality is, if we dealt with water and sanitation and the first line of healthcare defense, you will find that we will have a far lower cost on trying to keep our population healthy. But if you go around this country, I mean, water and sanitation is still a huge problem. The sewerage systems are almost non-existent in our slums. If you walk around Kibera today, if there was an epidemic of any kind, I don't know what the likely outcomes would be, because the place is extremely unhygienic. The second point I wish to make is on information sharing. I think at a time such as this, it is very important that we are verifying and actually, you know, making sure that the information that the public has access to is accurate. It is devoid of fake news. It is devoid of propaganda. We need to ensure that the facts are out there. And one of the measures that the government has taken, and I think it's quite pleasing, is that we have a single focal point. We know that the World Health Organization has been issuing very regular information bulletins. They have an information toolkit that gives also guidelines on response. So I think we need to control the information that's out there. We need to make sure it's timely. We need to make sure it is accurate and it is devoid of fake news and propaganda. And the third point I want to make very quickly is on the impact on trade. You know, Africa has a huge opportunity right now. And I think the fact that coronavirus has come and we've seen the vulnerability that we have and some of the examples that Odote and Mr. Shaw have shared right now actually reveal the fact that we are extremely vulnerable to China. But again, let us remember that trade is influenced by demand and supply. People will go for the product that has the easiest availability or at the best price. So Africa has a huge opportunity in actually looking at what our competitive advantages would be and actually rethinking this liberal trade regime that allows for the free movement of goods across the world. At a time such as this, I think it's an opportunity for us to look at what it is that we as Kenya can provide the region, how we can make the movement of goods and services easier within the context of the African Continental Free Trade Area.
All right. But we can actually also latch on that particular issue of information sharing. First of all, we think, and we have a very good salutary effort being put forth by the steering committee, so far led by the the CS Mutai Kagwe. But in a world where disinformation on social media is already a much used tool, COVID-19 also, coronavirus, as it is, will provide also new opportunities for spreading fear, uncertainty and doubt. And we've seen also locally here some of the clips from the slums where, you know, when we see people from the Chinese nationality being also ostracized and castigated, some of them calling them coronavirus. How should we try and also inform Kenyans that, you know, this is not truly their making? It will have started in Wahun as it is right now, but truly we cannot try and subject a certain group or try and ostracize a certain nationality because of you know, the coronavirus as it is. How sensitive should we be in terms of information sharing, and how frequent should that be, the updates that we should know how to handle this? Because I think this is very critical. This is where also we can have diplomatic tips between Kenya and China because of coronavirus handling.
And it can be very straightforward, very simple. For example, a bar of soap. It is one of the best preventatives. Washing your hands. We're all told that we're supposed to be doing that frequently, but let's really emphasize that. Let's make sure, because, you know, as you were saying, these basic hygiene measures are one of the ways that you can minimize it. I wouldn't say that you can stop it completely. And you know, when you look at, you know, the effect of soap on this, I mean, quite honestly, it's going to do. There is one business that's going to boom here, and that's anything to do with soap, the soap industry, because, you know, we're all being told, use that soap frequently, day in, day out, hour in, hour, you know, and it's one of the best preventatives. So I think just, you know, when you're talking about schools and anywhere where there's gatherings of people, that's very, very important. That you know, those facilities are there, and let's emphasize that you just go for those, what should really be basic hygiene, sanitary measures.
Right.
And that's why somewhere like Singapore is doing quite well.
Very well.
I've seen in the papers about the warning from the PS Internal Security on the issue of not being against the Chinese and speaking those kind of statements, because I think it's actually a dangerous thing. But I think we need to ask ourselves, what's the root cause of that issue? And that's what we need to deal with. The root cause of that issue is something extremely basic: lack of information.
Lack of information.
And we're told lack of information is a dangerous thing. But if you look at this show, every day we come, we get a copy of this constitution. This constitution is published by an organization called Uraia, whose only duty is civic education. If you take us back to before the 2010 constitution, you could not get a copy of the constitution. You know, the basic things, and I remember requesting the CS for health, that's one of the things he should, you know, basic things like, have you seen any flyer, Debal, anywhere on coronavirus? Just a one sheet. Robert makes the point, which is extremely fundamental, about soap, about washing hands. You know, almost everybody has water. Almost everybody has soap. But do they know that by washing their hands and using soap, they're preventing the disease? I bet you, Debal, 70% of Kenyans may have no idea. They actually think that this thing is only treated by medicine. That's the only thing to prevent it. Yet the basic things we can do. I think we need to invest a lot on civic education, on providing basic information. Let's have massive productions of just a one sheet on the kind of things to do. Give it to schools, so that every teacher can know what do we need, so that when you now tell the Ministry of Education, supply them also with sanitizers, supply them with soap and water every morning, they can relate that to what is happening. Let's have advertisements in the media. If you watch CNN today, almost every 5 minutes, there is something on coronavirus, which is just a basic advertisement. If you watch our basic news, I don't think that there is that kind of periodic information. It's only when we do so that we'll also be able to tell people that, by the way, the virus is not being carried by Chinese. This virus is global.
It's global.
Number two, the Chinese that you are ostracizing, some of them have been here for extremely long. I think over the weekend, as we were having a news item on it in one of the media, they were talking about some Chinese guy who is working on Thika Road, and he hasn't been to China for several months. So ostracizing Chinese will not help you. it is actually much more dangerous. So it's important for us to focus on the right thing. It's important for us to give people information so that they don't work on the basis. You know, if you don't give me information, I will assume. And unfortunately, when people assume, we then go to the wrong place, which is to then target the Chinese for no.
And we have a lot of ways, and I think Kip, you are spot on. When we talked about the big four, it was more towards preventive, but I think we had people see it as equipment. And beauty of preventive, you don't have to do that. And I think the point we are making here is we could even use the platform we have on M-Pesa. Short messages. Every time we are giving information about it. And I think, I go back when I got married, we were told 3 things. Communicate, communicate, communicate. 3 things. If you do that, and this is what I'm saying, let's use even the social media we have. We know government has information and communicate. That information given to the people becomes important. And at one time, as we were having dinner with this gentleman from China, has a Chinese ambassador probably come and talk what's all about it. I think that would be important in my view. But the other important thing, and I think this is perhaps something, I don't know how we look at it, and it's affecting the whole world. So this time it's not Africa. You remember? Yeah. I don't want to thank from later. We always used to be Ebola of Africa.
Yes.
So even when you look at the downtown of the economy not performing well in the world, it's affecting everybody. So it's important perhaps to appreciate that, and it is something we should learn very strongly, that how prepared are we as a world. And that's going to happen. This might not be the last one.
Let me just say something on the negative profiling of the Chinese. It's a topic that I discussed a lot when I was the president of the Chamber of Commerce. One of the big problems that we have with the Chinese is an important trading partner for Kenya and is a major global economy today. The problem that we've had in Kenya with the Chinese community is that there's many Chinese in Kenya engaging in very mundane activity that is in conflict with what the local people are doing. And this is something we've had a conversation around, and it's something that even the Chinese government themselves have been addressing. I don't think Kenyans are very happy when you see a forklift driver from China, when you see Chinese now starting to, vend, the fast-moving consumer goods on the streets, competing with our really small traders. So that's been one of the challenges that we've had. But let's shift a little bit from defining the problem to the opportunities. I see an opportunity. I mean, and we've got to always think of what, the flip side of every situation is. You see, we must contend with the reality that maybe schools will close. So there will be a huge opportunity in virtual learning. We need to prepare ourselves, like the public university, you need to prepare yourself for a time when you can continue to offer your courses without actually having people in a lecture room environment. There are opportunities in e-commerce to ensure that goods and services are delivered to homes. I mean, today, you can actually purchase a lot of goods without actually going to a supermarket. So there is an opportunity in e-commerce. There's an opportunity in manufacturing of hygiene products. There's an opportunity in the entire hygiene industry in training and facilitation, capacity building. So I want to say that right now, as we are dealing with one of the most serious healthcare challenges in recent past, there are also opportunities for those who want to get into business to ensure that they are providing the services and the goods that are required. And even looking at the possibility of working from home. Those of us owning businesses, yes.
It's on page 28.
The future of work. People
the future work is from anywhere, from at any time.
Yeah, one of my daughters recently got a job, and the job provides that she only goes to the office half the time. So half of the week she's in the house, and I keep asking her, what are you doing in the house? And she's working. And, probably doing more work than I am, driving around and thinking I'm doing business. Yes.